What if the immune condition you've been fighting for years didn't start in your joints, didn't start in your thyroid, didn't start in your skin? What if it started in your gut? Today I'm going to show you how a compromised gut lining can confuse your immune system into attacking your own body, and why the doctors that's treating your autoimmune condition may have never once looked at your gut. I'm Dr. Myra Reed. I practice functional and internal medicine. I've had over 35 years of experience, and I practice early detection longevity medicine. I help people find what others miss before the symptoms become disease. Everything I do runs through my 4 pillars: hormones, gut, lifestyle, environment. I am helping you to live smarter, stronger, longer, because I don't want your first symptoms being your last. This is week 2 of my gut health series. Last week, we talked about what leaky gut actually is. Today, what happens when leaky gut triggers your immune system to turn on you. Autoimmune conditions are not rare anymore. They're one of the fastest growing categories of chronic disease. Hashimoto's thyroiditis, rheumatoid arthritis, lupus, multiple sclerosis, psoriasis, type 1 diabetes, celiac disease, just to name a few. More than 80 autoimmune conditions are identified, and they are affecting roughly 1 in 5 Americans, and the majority of them are women. The conventional approach, which is identifying which tissue is being attacked, suppress the immune system, and manage the symptoms. And sometimes that is necessary. But the question I always ask is, why is the immune system confused in the first place? Because your immune system didn't just wake up one day and decide, I'm going to attack you for no reason. Something triggered it. And more often than you'd think, that trigger is in the gut. Remember from last week, your gut lining is 1 cell layer thick. There's these tight junctions that hold the cells together. And when those junctions break apart or break down, you get that leaky gut. And when the gut is leaky, things cross into the bloodstream that they were never supposed to have gotten there in the first place. Undigested food particles, bacterial fragments, toxins, viruses. Your immune system sees these and does exactly what it's designed to do, is to attack these foreign bodies. But here's the problem. Some of these particles look similar to your own tissues on the molecular level. This is called molecular mimicry. Your immune system attacks the foreign particles, and then the attacks look similar to some parts of your tissues, and so it attacks these tissues because they're confused on what they really look like. They can't tell the difference. And it's not that your immune system is broken, it's that your immune system is confused, and the confusion started when the gut lining broke down. Let me give you a specific example because this is well researched. Gluten stimulates the release of a protein called zonulin. Zonulin opens up the tight junctions. It literally unlocks the cells that are between the little gut cells. It breaks those cells apart. And in some people, especially those genetically susceptible, this creates a cycle. The gluten attacks the zonulin, which holds the tight junctions of the cells together, get broken open. The particles leak through the cells into the bloodstream, triggering your immune system, activating it, causing this inflammation in the body, and the tissue gets damaged. This has been studied extensively in Hashimoto's thyroiditis, celiac disease, type 1 diabetes, rheumatoid arthritis, lupus. The research shows that the connecting intestinal permeability is activating the autoimmune activation is not a fringe. This is actually published in major journals. But most rheumatologists, even endocrinologists, and most primary care doctors have never evaluated their immune patient's gut. Don't let your first symptom be your last. And in autoimmune disease, the first symptom may have started in your gut years before you've ever gotten a diagnosis. I want to tell you about a patient. I'm going to call her Michelle. She's in her mid-40s, diagnosed with Hashimoto's in her late 30s, on thyroid medication. Antibodies are still elevated. She also had bloating after each meal. She's had some joint pain, brain fog, fatigue, just feeling achy. She was getting these skin rashes that would come and go, and it would just flare up, and she just didn't even know why, what was triggering them. Her endocrinologist had managed her thyroid with medication. Her rheumatologist monitored her joints, gave her some medications, that pill for an ill. Her dermatologist gave her a cream. She'd been to 3 doctors, 3 separate problems. Nobody connected the dots. Nobody looked at her gut. When I evaluated Michelle, she had significant intestinal permeability problems, gut inflammation, bloating, indigestion, food sensitivities she didn't even know about, a disrupted microbiome in her gut. We addressed the gut first, removed the inflammatory triggers, repaired the lining, and supported her microbiome. 6 months later, thyroid antibodies really dropped. Bloating resolved. Joint pain significantly improved. Brain fog lifted, and her skin cleared up. She didn't need 3 doctors for 3 different problems. She needed 1 doctor who looked at the root cause, looking at her gut and what she was eating, what she was exposed to. If you have an autoimmune condition, here's what I want to know. What is the state of your gut lining? Is there intestinal permeability? What does your microbiome look like? Are there any food sensitivities driving this inflammation? What's your zonulin level? What are your inflammatory markers doing or showing? And critically, has anyone ever asked these questions? Because you cannot calm an immune system that's being constantly triggered by a gut that is constantly leaking. Immune suppression without gut repair is treating the alarm while the fire keeps burning. So what can you do? If you have an autoimmune disease and your gut has never been evaluated, ask your doctor for the gut-specific testing, the comprehensive stool analysis that I like to do. Look at some food sensitivity panels, those IgG, those delayed food onsets, the zonulin level, your inflammatory markers. And if they won't order them, then find someone who will. In the meantime, consider removing the most common gut irritants for 30 days. I always start with these in my patients: gluten, dairy, processed food, refined sugar, alcohol, sometimes eggs. See how you feel. Your body will tell you everything you need to know. Next week, I'm going to be talking on stuff if you're still having bloating after eating clean. I'm going to go to explain what your doctor is missing. We're going to talk about SIBO, S-I-B-O, low stomach acid, bile insufficiency, and why eating cleaner doesn't fix the real problem. Then there may be some other clues that we need to look into. If you or someone you love has an autoimmune condition, then please share this video with them, because the gut connection could change everything. Take my free assessment. The link is in the description. Everything I do, every protocol, every patient, every video runs through my one belief. I'm Dr. Myra Reed, helping you live smarter, stronger, longer. I don't want your first symptom being your last.